Good morning, Dr. Sharma. Thank you very much for joining us today. Based on the recent FDA approval under a humanitarian device exemption for the treatment of osteoid osteoma, I'd like to talk with you about your experience, the disease, your trial results, and how MR-guided high-intensity therapeutic ultrasound can make a difference for patients.
Good morning, Hartmut. Thanks for giving me the opportunity to speak with you today, and I'm happy to discuss all of those things.
Absolutely, great. Let's get started then. So first question, can you briefly introduce yourself and provide a little bit of background on MR-guided high-intensity focused ultrasound, MR-HIFU?
Sure. My name is Sharma. I'm the Director of Interventional Radiology here at Children's National Hospital in Washington, D.C. I'm also the Associate Director for Clinical Translation for our Sheikh Zayed Institute for Pediatric Surgical Innovation. MR-HIFU, as you know, basically combines an MRI scanner to identify a target or target tumors in our case, and an extracorporeal ultrasound transducer. The extracorporeal transducer generates ultrasound waves that can be focused on targets that are selected based on the MRI imaging. The energy of the sound waves is focused to a point and generates enough heat to thermally ablate the target. Because the ultrasound transducer is external to the body, the treatment is completely non-invasive. And also because the guidance is provided by MRI rather than X-ray or CT, it's also radiation-free. I was first introduced to this technology in 2008 when I was working at NIH in Brad Wood's lab. And at that time, we were looking at uterine fibroid embolization and ablation, and looking and doing a trial comparing the radiology findings and the pathology of uterine fibroids. But we started beginning, even back then, thinking about pediatric applications, especially in the pediatric oncology space. And when I moved to Children's National, we were fortunate to have the SONALLEVE system here. And I've been working with that to treat patients on clinical trial since about 2014.
Thank you. Let's talk now a little bit about the disease. What is osteoid osteoma, its symptoms, and how does it impact children and young adults living with it?
Sure. So osteoid osteoma is a benign but painful bone tumor. And as you suggested, it occurs mostly in children and young adults. It's a relatively rare condition, but it does account for about 10% of all benign bone tumors. Here at Children's, we typically see about 6 to 10 patients per year. And the hallmark of this benign tumor is that it causes localized pain that is not associated with trauma in children. And typically this pain is worst at night and interferes with their sleep. And because it interferes with their sleep, it also interferes with their daily activities, including school and schoolwork and physical activity and participation in sports. In the past, it was treated generally with something called radiofrequency ablation. And even going back further before, so about the 1990s, it was actually treated with surgical resection, where we would take out the focus or the nidus of the osteoid osteoma. That was a little bit more invasive and involved some collateral damage to the overlying tissues, such as muscle and bone, connective tissue and bone. And then in the 1990s, there was a technique introduced called radiofrequency ablation. With radiofrequency ablation, we typically place a patient on the CT scanner to visualize the osteoid osteoma, and then use a bone drill to place a needle, a special needle called a radiofrequency probe, into the osteoid osteoma nidus and essentially burn it from the inside.
Okay, thank you. And in that context, so how can MR-HIFU improve therapy outcomes and minimize complications, and why is MR guidance so beneficial?
Well, that's a good question too. You know, our guiding principle in Sheikh Zayed and in our surgical institute is to really minimize and make treatments and surgeries less invasive. Another guiding principle in radiation and pediatric radiology is really to minimize radiation exposure to children. So we're bringing together in MR-HIFU these two sort of guiding principles to really minimize radiation exposure to the patient, and also to perform a treatment that is non-invasive and really minimizes the risk of collateral tissue damage. And so in 2014 or so, we began our MR-HIFU program, thinking about clinical applications in pediatrics. And osteoid osteoma was at the time a very relevant application, one that we could begin to translate into the pediatric population. And although we had been doing radiofrequency ablation for several years at the time, we wanted to move towards something that was more non-invasive. So we're moving from minimally invasive radiofrequency ablation to completely non-invasive MR-HIFU.
Great. Now a little bit about your findings from your pilot trial. So can you describe the results and findings from your osteoid osteoma trial?
Sure. So in our osteoid osteoma trial, the pilot trial that we performed, we treated 9 patients, and we found that MR-HIFU was safe in all 9 patients without any serious adverse events. And we followed these patients up initially closely for 12 months, and we found that there was complete pain relief without any further medication use in 8 of 9 patients. Although one patient did have a recurrence after 1 year, the same patient had previously failed radiofrequency ablation and surgery as well. So that patient may have been a bit of an outlier. And one other patient had partial relief early on, and that was because the osteoid osteoma was within the bone at a deeper area, so intramedullary osteoid osteoma. We also contacted these patients at about 5 years after treatment and found that all of the patients who had complete response at 1 year also continued to have complete response at 5 years. And they no longer were taking any medications, and they were back to their usual activities, including sports and schoolwork, and some in their jobs now.
Excellent. So can you provide maybe example on how MR-HIFU has changed in the lives of patients and their families?
Sure. I think there are several children that we've followed up with who are even now 5 years later, not so young anymore. But I think complete pain relief without interference in their sleep and without interference in their schooling and sports activities and so on, participating in physical education classes and getting back to swimming, for example, in a couple of patients, and other sports, were things that the osteoid osteoma patients, at least I feel, were happiest about. That's what they commented to us. For the younger patients that were in our trial, their parents and the patients were extremely happy that they no longer had to take pain medication and that they were able to sleep throughout the night without waking up. These are the sort of things that I think, and you know, this treatment for osteoid osteoma, although it is not a malignant tumor, has a lot of beneficial effect on quality of life for these patients.
Great, thank you. What is the cost structure of MR-HIFU in comparison to standard of care?
Well, Hartmut, that's an interesting question. We are still not, it's a question that still needs to be answered completely. What I can tell you, and based on our clinical trial and also the experience of others, is that MRI scanner time is usually more expensive than CT scanner time, which is where we do the radiofrequency ablation. However, with MR-HIFU, we do not have the high costs of disposable equipment, such as the bone drill and the radiofrequency ablation probe. In our preliminary look at this, it seems that the estimate suggests that the cost between MR-HIFU and CT-guided radiofrequency ablation should be fairly similar, all things being equal. But this really does need to be evaluated in a systemic way. And in our next phase trial, which is our pivotal trial of 30 patients, we will be paying special attention to the cost structure.
Excellent, thank you. Can MR-HIFU replace the current standard of care treatment options and become a mainstream treatment modality for symptomatic osteoid osteomas, from your perspective?
Yeah, let's look back a little bit for a longer term and a historical perspective for that one. I think approximately 30 years ago, if you looked at definitive therapy for osteoid osteoma, that definitive standard of care was surgical resection. Then when radiofrequency ablation was introduced, it has gradually replaced open surgical resection. And today, that is the current standard of care. I think that with the advantages that we have with MR-HIFU, once again, the lack of radiation exposure, the completely non-invasive nature of the therapy, and also the fact that we can be a bit more precise with MR-HIFU than RFA because we use something called MR thermometry to really show us precisely where the heating is occurring and keep it focused on the osteoid osteoma and away from the surrounding structures. I believe that this has the potential to, maybe in the next decade, replace radiofrequency ablation. There are currently some challenges with device availability, but once those are sort of overcome, I think that it could very well replace needle-based ablations.
Excellent. Dr. Sharma, last question. Outside of osteoid osteoma therapy, what are the current endeavors and next steps of the Children's National Hospital MR-HIFU program?
Right, so the MR-HIFU team here at Children's National is moving beyond osteoid osteoma to other clinical applications that are important in pediatrics, and these include metastatic bone and soft tissue tumors, especially those that are relapsed or refractory tumors, and they don't have any other great treatment options. For these tumors, we're using not only the thermal ablation capability of HIFU, but also other HIFU modes and biomechanisms such as hyperthermia, mild hyperthermia, to facilitate a targeted and enhanced drug delivery to the tumor, as well as a mechanism known as histotrypsy or mechanical tissue fractionation to enhance enhance cancer immunotherapy. We're also hope to move into MR-HIFU brain applications in the pediatric population to treat certain forms of epilepsy and certain brain tumors as well.
Dr. Sharma, thank you very much for this very interesting conversation. It's really impressive to hear what you have accomplished so far at Children's National Hospital, and that the treatment of osteoid osteoma with MR-guided high-intensity therapeutic ultrasound does represent a fantastic non-invasive and radiation-free alternative to the current standard of care. Thank you very much.
Thank you very much, Hartman.